The following program is presented by the Metropolitan Library Service Agency.
Hello, welcome to All About Kids, a program focusing on the interests of children and young people and some of the issues affecting them. Our program today will focus on a number of issues affecting children, particularly those that were discussed in the 1990 session of the Minnesota Legislature. Our guest, State Representative Karen Clark, District 60A, Minneapolis, has assumed a leadership role in the Minnesota Legislature in terms of child advocacy issues. She'll be joined on our program by Nancy Johnson, a staff member with the Greater Minneapolis Day Care Association. Representative Clark, Karen, and Nancy Johnson from Greater Minneapolis Day Care Association, thank you very much for being with us today. We've agreed generally that child care is in a real crisis situation in the state of Minnesota and also federally or nationally. Nancy, why don't you give us a little background on this whole situation, please?
Well, the context for the crisis is that child care, even though it's a very necessary service for working parents and also a way for kids who are from disadvantaged homes to get a head start and to get a chance to kind of catch up with their peers, is not funded the same way that we fund other services, for instance, public education. So what we see is a crisis in terms of turnover. Staff are not paid well enough to attract good people to child care and to keep them in it. Even with family child care providers, they're not making enough to stay in the business, so there's a large turnover in family child care, up to 50 and 60% a year. So what that does then is that makes the whole system not work for kids because kids need stability.
Do you think there's a lack of awareness in the general public that child care is not just babysitting, that it really is an early childhood development? It's an educational thing as well as being custodial?
Yeah, I think that's at the root of part of the whole crisis, is that it's not well understood that this isn't the same as mom staying home with a few of her own children. But these are women who, and men, but 99% of the field is women, who are working with kids from all different backgrounds, kids who are not related, and for a whole day. I mean, it used to be that a lot of kids were going just for a few hours in the morning for nursery school, but now we're talking about 8 and 10-hour days, and that's a real different proposition. So that's true.
What about the training for people who go into child care?
Well, we know, what's frustrating is that for those of us in the field, we know how to train good child care workers. We know what works, but part of the problem is, how do you keep people in a field where even after they're trained, they're still only making $5 and $6 an hour? There isn't much incentive there to get more training, and if they're constantly having to struggle with their own bottom line in terms of what they need for a living, they're going to look at other jobs, and so we lose that training that we did invest in individuals.
So there is a responsibility someplace. Karen, you've assumed a real leadership role in the Minnesota Legislature in focusing on child care issues as well as other issues which affect children and families. Do you think the legislature is responsible for curing this, or Congress, or what's your opinion?
Well, I think we're all need to be in partnership on this issue. The legislature is trying to make some efforts, and I'm really pleased to say that we have a task force of very dynamic and concerned and committed people that was appointed and actually authorized, and some money was appropriated by the legislature to look at the issue of how do we develop a comprehensive and coordinated child care system in the state of Minnesota, and how do we pay for it? Because a lot of the problems that we can talk about here today could be solved if we just had enough financing behind them. That's really a very major problem, and part of the way to win, I think, the kind of dollars that we need is to begin doing some things on the state level, to build a pressure, to build grassroots pressure, to build pressure at the state legislature, and to take that to the federal government. And that is happening. There is, and has been, several different opportunities now for our federal government to pass child care funding legislation. and they are kind of going back and forth, and I'm hoping that what we'll do at the state level is happens around other, I guess, kind of important economic justice issues, is that if enough states really take seriously the needs of our families for child care services, both the kinds and qualities of services and the funding for it, we'll get a lot of states saying, say federal government, we need your help, we can't do it all, because we can't. It's like healthcare. We can provide some leadership and point the direction and maybe set basic standards, but we need the kind of funding that only really the federal government can help create through probably, I guess, a fair tax kind of system, and we could talk about some of the different choices there.
Now the Task Force on Children is in the process of preparing a report which will be given to the Minnesota legislature.
We're actually still studying the problem. We've divided a little bit into the two tasks that are assigned to the task force. One is, how do we make this system coordinated? How do we make all the different parts that already exist, from individual family daycare homes to the more sophisticated centers, the disparities that we have all over the state in people finding those kind of resources. How do we coordinate that some way, get parents involved, get local units of government involved, get families involved, and serve children? How do we do that? Have a quality system. And then secondly, in another part of the task force, we're looking at the financing mechanisms. And we've been bringing in some national experts to help us look at those issues, and we're trying to figure out what would work in the state of Minnesota. We're due to give our report January 1991. So we have a summer and fall now here in 1990 to try to finish studying and make recommendations and actually prepare a formal report.
Are you looking at other programs like Head Start or even nursery school?
They're all part of the array of folks that are on the task force and that are offering suggestions and that need to be considered as part of the system. And they have seats, those folks, as you mentioned, Head Start, people who have are working in family daycare, working in centers, have some part in the educational system. We've brought them almost all to the table. I don't know that we've left any people out that we could think of. We've tried to bring in business.
Right. I think in special needs, that's another burgeoning problem. Children with either handicaps or delayed development, and what are the services for them, and how do parents access that, and how do programs get enough funding to really make quality services available for those children. So, and there, as you can see from what Karen's talking about, it's a huge task because there are so many different ways in which children need help and that parents need help. And we're not suggesting that there be one system. Not all parents need full day care. Some do. Not all children need the kind of program that Head Start provides, which is a part-day program but really looks at enriching those children's lives. But some children do. A lot of children do. And one thing is that Minnesota has a system that's really looked at as a model for federal legislation in terms of our state sliding fee. Because what that program does is it says that based on a parent's income, there are monies provided also based on what the cost for the kind of program that that parent is looking at in terms of what they need for their child. And it's a good program, it's a good basic system, but right now, in May of 1990, we have 7,000 families on waiting lists all across the state. And in Hennepin County alone, there are 4,500 families waiting. So it's a tremendous need, and we have the system set up, at least in that sense, to deal with what the costs are right now. But the other thing that the task force is looking at is, even if we provided monies to all of those families to be able to use child care at current rates, that still means that providers are going to have to pay their workers the incredibly low wages that they're getting. And we're talking about teachers with four-year college degrees who could step out of child care at any day if there was an opening, for instance, in kindergarten, and all of a sudden be making $24,000 to $30,000, but in child care they're making $14,000. So that's really what we're talking about in terms of that the funding is critical to all of this.
Well, it's a whole societal thing too, the idea that caring for children is not somehow worth as much monetarily as something important like going off to an office every day.
Right.
It's a very frightening sort of thing. What kind of mail do you get from constituents? As a a child advocate myself, it seems to me like we've become more visible at the Capitol, but are you getting those letters from the grassroots folks that you talked about?
I get some letters. I tend to get a lot of calls because I serve a Twin City urban area, inner city area, and I think people find it a little easier to pick up the phone, and pretty often it's the crisis call. You know, I have the opportunity to go off welfare and take a job, but there's no money for childcare. Why isn't there? Why can't I get on this program? Or even people who thought they were going to be able to go to school. We had a number of folks last fall who had pretty much been signed up to go to maybe a community college or vocational technical school or maybe a university, and the dollars that were needed for that were not available, and it just meant that all the plans that a person may have made to you know, get some training so they could be more self-supporting had to be dropped. It was very discouraging, and it's one of the reasons that we worked very hard to get this task force set up to come back with some sort of legitimizing, hopefully, recommendations to the legislature. We want to do really good research and be able to lay it out there and say, you know, this is what we've found. This is the problems in the system. We could bring these parts together. We need to stop having some turf battles here. We need to really understand what our families need, what our children need, and then we need to get tough and figure out how to pay for it. And that is where the political courage is going to be required. And I say to the people that call me, thanks for the call. You know, I'd like to tell your story. And also, if they don't happen to live in my district, I really encourage them to call their legislator. You know, call the governor, write a letter, try to, you know, impact the federal legislation, write to our congressmen and U.S. senators. There has been a lot of money spent on the notion that we should not have a tax increase in the state of Minnesota or in the nation. You know, I mean, election campaigns, both from presidential on down, have been won or lost on that, and unfortunately it still seems to be a theme. But it was a very orchestrated kind of effort, and I think one of the messages I would have for people who are listening to this is, you know, if you need these services, if these are really things that make a difference in your being able to have the quality of life that you expect as a Minnesotan, as an American, think about whether or not that politician who's promising you no tax increase really has your best interest in mind. I mean, if this means that you pay a little, someone, perhaps the folks on the top who are benefiting the most, pay a little bit more money, or maybe the employer has to kick in a little bit more, gives you the opportunity to, you know, to have this job that you've been after, or get off of welfare, or get your child into a special needs program, would it be worth it to have a bit of a tax increase?
Right. Great political courage.
Right. Well, and there are polls saying that when people are asked if your taxes were increased specifically for children, specifically for programs not just given to a general fund and then, you know, hoping that the leaders who are there making those decisions allocate those monies, but if you could assure that your tax dollar was going to help children, would you increase your taxes? And the majority say yes.
That's correct.
You know, so that's part of it too, is maybe we need to look at the tax system and figure out how do we make sure that that money goes to children.
You're a brave lady too.
Well, the task force is looking at that in terms of a sort of dedicated tax. That's one of the things we've looked at, and it is controversial.
And it's not a chickadee checkoff.
It's not a chickadee checkoff.
Bigger than the chickadee checkoff.
We're talking about hundreds of millions of dollars. I think something like $300 million, maybe if we were to look at the situation right now. That's small when you think about what we spend some dollars on for bombers and, you know, constructing you know, all kinds of facilities for sports and traffic and all that. I mean, we need to, I think, look at our priorities. And part of the challenge that I think we're facing and that you're facing by bringing this issue up is where are children our priorities?
Right. And children can't wait. I mean, I think that's the other thing that I get impassioned about when I realize that it's taken 2 years to get through Congress some legislation that addresses the need for systems change in child care, regulation in places where there are no regulations. Minnesota is one of the states that's fortunate to have a fairly good, strong regulatory system so that we know that it's not completely up to the parents. And you can't base child care on a system where parents would have to go in and make sure that everything's fine every day. Parents just don't have either the knowledge or the time to do that. So you do need to have a regulatory system in place. But this legislation would extend that nationwide. And even more so, what the legislation would do is give money to parents for choice, so that parents can either use family child care providers or centers. It also gives money for parents to choose centers that are located in churches if that's their choice. It also gives money for that critical thing that we talked about at the beginning, which is the whole crisis of staff turnover. And so it's very comprehensive legislation. It does include tax credits, which is what President Bush said that he would support, but it goes much beyond that, and it addresses the whole needs of a quality system. And both houses of Congress have passed different versions of that legislation, and it will soon, after the conference committee decides exactly what's going to be contained in the final legislation, it will go to President Bush's desk. And the message needs to be for listeners and people who are real concerned about children. We can't wait. We can't have a veto at this point and go back to the drawing board and spend another 2 or 3 years coming up with other legislation.
Because those children will have progressed out of the child care system into the school system and inadequately prepared.
And studies have also been done, long-term studies of the benefits of child care. And for every dollar invested in child care, we save $6 to $7 throughout the lifetime of that child, because there are lower juvenile delinquency costs and welfare costs and court costs and all kinds of. So the society is really, the question really is, do we invest in our children up front?
That's it.
And then instead of long term, and that's real hard for this country because we're not built on that. We're built on short term,
intervention when it's too late almost, when the child has become a juvenile delinquent.
Yeah.
And we have short-term budget kind of mentality, unfortunately. In the state legislature, we have 2-year budgets. You know, it's difficult. I'm hoping that the plan that we come up with this task force, it will be something long-term, but then we need to keep the pressure on and keep the consciousness clear. The problem is not solved by putting money in for the crisis. This year we had a crisis. We had a crisis between the working poor and the people who are on AFDC and needed child care. And we needed to handle that crisis this year. We needed to figure out a way to make sure that both people who are on AFDC getting training to get off it and those who are already in jobs could get some of the child care dollars. And we put
was that the STRIDE program?
The STRIDE program is the program that assists people who are on AFDC to get training and get off of AFDC, and they do that partly by being able to have access to child care dollars that enable them to go to school or to take a job. And we had the problem, and some of the calls I got were from people who were saying, gee, there's no money left for me. I've been working on this job. What am I going to do? Do I have to go back on AFDC? We needed to solve that problem. Well, that was kind of a short-term solution this year. We created 2 pots instead of 1 so they didn't have to compete with each other. We didn't put enough dollars in, we put some in. This year we started out the whole legislative session with a deficit, with a projected deficit, I should say. And so we couldn't spend as much as we would have liked to. I'm hoping this task force and others will come back with a lot more comprehensive picture and a longer picture of this is what we need to do step by step. This is what the picture should look like when it's done. It should be this kind of a system with all these choices for families and so on.
So a well thought out plan, nothing haphazard, and something that you can sell to people who might be more...
We can start to sell. I've been in the legislature long enough to know that it won't happen overnight. And the kind of dollars we're talking about raising is going to take a lot of pressure, a lot of political courage, a lot of... there's an excellent opportunity. The fall elections, 1990, every single state legislator is up for election, and so is our governor. And there's the opportunity, I think, for people to have the conversations from their own experience about what their needs are in terms of child care. Maybe it's even, if not their own, their families, their neighbors, their sons and daughters, so on, the needs they have that they can recognize in terms of the issue of funding child care services.
What about the legislators that get off the hook by nodding and smiling and then saying, but those aren't my committees?
We all have a vote. It's not an adequate answer. We all have an opportunity to influence the priorities of the budget.
And the other thing is they listen to their constituents, and providers are constituents.
That's right.
There are 1,200 providers throughout the state of Minnesota in center care, and there are 10,000 providers, just licensed providers of family child care homes. So that's a pretty big constituency right there.
And they've got all those parents.
And they've got all those parents, and I think one of the things that we're talking about in terms of the child care field getting organized ourselves is that the legislature is one partner in this.
Yeah.
But as you mentioned earlier with pressure, the other message for child care providers is to look at the way that you do business, the costs of care, the quality that you want to be able to offer to children and families, and begin to consider yourself as a valuable part of that whole process, and you're going to have to raise your rates. And that's a very scary thing to put out there. But I think what it does then is it says that the child care worker and the family child care provider aren't the only ones who need to make sacrifices for children.
They are professionals. They have the expertise and the training to do a good job.
And they know that we can't continue with the low rates that we have right now. So there are families who can afford a little more for children. There are a lot of families who can't, but whose responsibility is it to keep the rates low? Is it the responsibility of the provider, and is it to make very little money at what she's doing, and is it the responsibility of the center staff to make very little money and choose other jobs so that we're constantly dealing with turnover?
Sometimes, I was just going to say, I do know of instances where we have people who work full-time in child care and they themselves are receiving public assistance because the pay is so low they cannot afford to live on it. So I think Nancy makes a very important point. We cannot fix this system on the backs of low-paid workers.
These women are working without coffee breaks.
That's
and
right.
The style that we're accustomed, no lunch hours. Those that can afford to take vacations are
right. And
No
things that
benefits,
influence
no
quality.
benefits,
I mean,
right.
we don't have paid planning time. We don't have good training and staff
no
training.
sick leave.
No, yeah.
No respite care.
Right. And here workers who are, exposed to children with a lot of germs all the time. So just in terms of their own working conditions, they're lousy, but also in terms of building quality care for kids, we're not providing that either. So it's like we're asking them to work with their hands tied behind their backs, and that's frustrating for workers.
Well, there is that societal responsibility to see them as professionals. We in the library do a lot of workshops for child care providers, and we talk about using books with children and kinds of library services that will help them enrich their programs. And consistently evaluations come back saying, you treat us like professionals, and we appreciate that because we see them as partners in raising children.
Right.
And we're kind of on the outs because a lot of child serving or youth serving agencies don't always see how the library fits in, which kind of brings up the issue you delicately alluded to it, the turf issue. There is, a small pie or a pie that's cut in a number of ways. Is child protection and children's mental health and K through 12 education, funding for public libraries, are those programs all competing for the same tax dollars?
In some ways they are. Certainly most of the ones you mentioned, for example, I vote on the House Appropriations Committee. We look at a lot of those issues, and we have only so much money to spend. I think I should maybe bring in here the fact that there is another partner that we need to include in this discussion and need to ask them to pay their fair share, and that's business. Government alone does not have a big enough pot of money to handle all the needs that you just mentioned. And it's real clear to me when we get in that room and there's, here's the list and here's what we have to put into the various pots, that we need to make sure that business, who, after all, are on the receiving end of child care supported workers. I mean, I think we could look at subsidies to child care workers as subsidies to businesses. The very businesses who hire them do not have to pay them that benefit. Now, there are some businesses that are starting to look at child care centers or child care benefits as part of what they offer to get well-paid and committed workers. But we have a long ways to go in that, and we need to get business chipping in their fair share. It's the same kind of issue I think that we have dealt with in the past around health care. It always, I think, leads back to the fact that the pot of money that is put there together, it has to have both a public commitment and a public admission of responsibility. It's not just that poor family struggling alone out there in the world. I mean, people get into blaming themselves for not being able to give their children what they need. And partly it's a societal problem, and it includes government, and it includes business, includes our education system. And I think we need to find ways to make the best use of the limited dollar so that the share that's available there goes in the most efficient way, and also that there's some justice involved.
Right, right.
Two good issues. The whole idea of economic vitality directly relates to how families in our society are able to care for themselves.
Just one analogy to make is we long ago decided that education was something that we all as a society had an investment in. And we started paying for the education of small children all the way up. You know, we all, whether or not we have children, pay in our taxes for education.
Public education.
Public
from kindergarten
education.
Through, yeah.
That's correct. And I'm thinking, and I think the task force is looking at the fact that we need to have that same kind of understanding of child care and child care services and quality.
That responsibility starts with a child at birth.
Right.
Or maybe even supporting the parents before birth, and that's where the health issues come in.
And it belongs to all of us. We all benefit or lose if we don't take care of that.
Yeah.
You have both been very eloquent on these issues this morning. I appreciate your being here. We've just got a couple of minutes left. Do you have a last exciting statement?
Well, I would just urge people to communicate with me and with Nancy, members of the Child Care Task Force. We need to know that we're on the right track, and we're very interested in making sure we have a coordinated system and that we have the public support to pay for it.
I think the thing that always astounds me is it's a phone call. You dial the number, and it's not talking to some terrifying image of the President of the United States. It's a real person who is interested in what goes on in our communities, no matter where they are, and they are interested in our opinions. And that's why I appreciate the fact that we can call all of you, and I hope a lot of people be lucky that the message is coming in. During the interim now, especially in the summer of 1990, is a good time to give opinions.
Right. I can give my office number, which is 296-0294. The Commission on the Economic Status of Women would also be willing to take calls, and they are listed at the Capitol. And maybe you would like to...
And Greater Minneapolis Day Care's line is 341-1177. And I guess I would just add that in addition to looking at public solutions, I think providers and child care workers need to look at their own, organizing themselves, building pressure from that end, and working together with parents, but, seeing themselves as being able to take action right now.
United, we can make a difference.
Exactly.
Right. Thank you both very much for being with us today.
Thanks.
Thank you, Representative Karen Clark and Nancy Johnson from the Greater Minneapolis Day Care Association. That was a lively and informative discussion. Thank you for joining us on All About Kids. Please tune in again.
This has been a presentation of Hennepin County Library in conjunction with the Twin Cities Metropolitan Library Service Agency. We thank you for watching, and we hope you visit your public library often.